The project is about the experiences, support needs, and quality of life among cancer patients. And the setting for the studies, the pilot study was carried out at Federal Medical Center in Ondo State, while the main study was conducted in this facility. The study adopted a descriptive cross-sectional design using a mixed method approach. And what I mean by the mixed method approach is I use both qualitative and quantitative method. And the aim of doing this is to have an in-depth understanding of the variable of interest and also to obtain a rich data set. I did the qualitative aspect first before the quantitative, and the target population are cancer patients that are receiving care in this hospital, and they are grouped into those who are on admission on the wards and those who are receiving care on outpatient basis, coming to the clinic on outpatient basis. And this study looked at their experiences, support needs, and quality of life across the disease trajectory. That is, right from the period of diagnosis, I looked at those that are newly diagnosed, those who are on treatment, and those who have completed treatment. For the qualitative study was used to explore their experiences and their support needs. And I make use of, to collect data, I make use of the method of data collection was through an in-depth interview, a one-on-one interaction with the patients, where using interview guide, they are open-ended questions where they express themselves, what it means to live with this illness. And following the interviews were audio taped, audio recorded, and also they were transcribed verbatim and then analyzed for teams. For the quantitative method was used to explore to assess their support, the types and level of support needs, and also quality of life as they go through the illness experience. And I made use of two standard instruments for the questionnaire. Two standard instruments, the supportive care needs survey instruments and the European Organization for Research and Treatment of Cancer quality of life instruments. These two instruments were used to assess these variables. The questionnaires were developed and administered to them in the clinics and some to those who are on the ward, and it was interviewer administered. After the collection of data, the data cleaning was done, after which the data was inputted into the system and then analyzed for results.
The results we got from the pilot study actually assisted us in validating the instrument for our main study, because we all agree that cancer is an area that majority of people are putting more attention on. But the more they put attention on it, the grantor look for people that had worked on this area over time, established name, professors and the rest. And my candidates being a graduate student, this will be our first time working on cancer, and our proposal attracted that grant. It really helped her to do our work, because we looked for other grants and they were asking, have you worked on this area over time? But the MBB grants believed that you just don't start flying in a day. You start from somewhere. And being our first time working on cancer, they still believed we could do something. The findings also helped us to map out what needed to be done when doing our interview for the main study. And for the interviewee too, they appreciated the fact that at least someone is interested in their condition. And we hope that when we will publish the results of our pilot study, we'll be able to communicate it both through peer-reviewed journal and even give feedback to the participants that were used for the study.